Today we would like to present two cases of congenital ichthyosis. One with this baby with severe ichthyosis with bilateral upper lid ectropions, which is the most common ocular presentation, and the other child with milder form of congenital ichthyosis but severe keratitis in one eye with no history of trauma. So now, what is congenital ichthyosis? It is a group of genetic disorders that mainly affects the skin of the patients. Skin of these babies is very hard, thickened, and they are usually encased by the collodion membrane at birth, which cracks and is then shed off. Now, these skin abnormalities affects the shape of the soft tissue structures like eyelids that have less resistance, nose, ear, lips, and limit the movements of the arms and legs. Collodion baby is the term often used for these congenital ichthyosis patients. A baby who is born encased in a skin that resembles a yellow, tight, shiny film or dried collodion, sausage skin. Now, as the collodion membrane dries up, it can crack, leading to fissures. Now, this affects the barrier function of the skin, leading to infection, temperature regulation, overheating or cooling, dehydration. Another concern is that the membrane acts like a thick film, causing physical constraints of the underlying tissues. This can create problems with sucking and breathing. So babies are kept in incubator, neonatal ICU. Previously the disease was almost always fatal, but now with improved care we give tube feedings, IV fluids. In incubator there is temperature regulation. Aim is to keep the skin moist and attempt to reduce scaling. Collodion membrane should not be debrided. Petroleum jelly is used to keep the skin moist. Paracetamol is given for pain relief. For ocular problems, dryness, artificial tears. For mild exposure keratitis, cyclosporine drops. For inflammation as well as dryness. Now these patients have dry eyes, limbal stem cell deficiencies, and they are prone to microbial as well as exposure keratitis due to everted lids. So if spontaneous resolution of the ectropion doesn't occur with lubricants, the surgical repair is necessary of this cicatricial ectropion. So we release the lid, remove the scarred tissue and graft, and it has got a very good results. Tarsorrhaphy with amniotic membrane grafting can be done to treat persistent corneal epithelial defects and even perforations. For frank perforations, tectonic grafting can be done. For keratitis, topical antibiotics should be given, and cause should be evaluated, like keratitis can occur due to exposure keratopathy, due to trichiasis, due to predisposed dryness of the eyes, lid margin disease, tear film deficiency, limbal stem cell deficiency. So the cause should also be addressed. Now such babies can survive longer, but they need combined efforts of ophthalmologist, dermatologist, and neonatologist. So I hope in this video you have got some idea about the collodion babies and congenital ichthyosis. Thank you very much.